Hello friends, welcome to Pathology Riddles. Today we will discuss about the etiological classification of anemia. This video is made for MBBS students as many of you get confused between morphological and etiological classification. Etiology actually means cause. So this classification is based on the causes of anemia. Etiologically, anemia can be broadly classified in three types. Anemia due to blood loss. Second is anemia due to increased red blood cell destruction. Third is anemia due to decreased red blood cell production. So in this video, we will be discussing the first two, anemias due to blood loss and anemias due to increased red blood cell destruction. So coming to the first category, which is anemia due to blood loss. It can be either sudden blood loss, which is due to acute blood loss, for example, any road traffic accidents. Then gradual blood loss, which is also called chronic blood loss, for example, any gastrointestinal tract lesions or gynecologic disturbances. Now coming to the second category, that is red blood cell destruction. It has 8 subcauses. Now the first subcause is inherited genetic defects. There can be RBC membrane disorders, for example, hereditary spherocytosis. There can be RBC enzyme deficiencies, for example, glucose 6-phosphate deficiency, G6PD. There can also be hemoglobin abnormalities, for example, thalassemia, sickle cell disease. Coming to the second subcause, which is RBC destruction is acquired genetic defect. For example, paroxysmal nocturnal hemoglobinuria, which is due to deficiency of certain glycoproteins like phosphatidyl inositol linked glycoproteins, which we will study later. Third subcause is antibody mediated destruction, for example, transfusion reaction, hemolytic disease of newborn, etc. Fourth cause is mechanical trauma. This can be due to microangiopathic hemolytic anemias due to narrowing of the vessels, for example, disseminated intravascular coagulation. Mechanical trauma can also occur due to cardiac traumatic hemolysis, for example, defective cardiac valves. It can also be caused by repetitive physical trauma, for example, marathon running or march past done by army personnel. So the fifth subcause is infection of red blood cells. It can be due to malaria or babesiosis. Sixth subcause is toxic or chemical injury to the RBCs. For example, snake venom poisoning, lead poisoning, etc. Seventh subcause is membrane lipid abnormalities. For example, severe liver diseases. Eighth subcause is sequestration. For example, hypersplenism. As told earlier, the third, that is red blood cell decreased production, will be discussed in the next video. As you understand each disease, it will be easy to remember the classification. Stay tuned for more videos. Signing out for now, Pathology Riddles.